I mean, we aim to serve everybody. So yeah, we do testing for high-level athletes, whether they're triathletes, cyclists, runners, power sport athletes, but we also serve people who are not athletes and just want to be well or healthy.
Hello, and welcome to Season 2 of Sounds of Health. This is the show where we uncover inspiring stories, meet incredible people, and share valuable resources to help you boost your physical, emotional, and financial well-being. I'm your host, Dave McNiven, and today we have an amazing guest, Dr. Bill Lunn. He's a professor of exercise and sport physiology and nutrition, and he also leads the CHAMP Center at my alma mater, Southern Connecticut State University. CHAMP stands for Connecticut Health, Athletic, and Mental Performance. I hope I got that right, but it does sound like a perfect topic for our show. Dr. Bill, welcome.
Thank you. This is great. I'm very excited to do this.
Yeah, we appreciate you taking the time out of your busy schedule to be here with us today. I don't know if you realized, but you are the premiere episode of our second season.
All right.
So thank you so much for doing that.
Excellent.
We have kind of this theme going overall for our new season. And that's kind of an upgrade your life, upgrade your health. Jason and I are upgrading our technology. So these cameras that you see here, this is all new to us. So you're kind of a guinea pig today. I hope you don't mind.
Glad I can be a part of it.
Okay.
Yeah.
Awesome. So let's dive right into everything. So usually what we start with on this show is, you have all of these different titles, right? It sounds like you're doing some incredible work out there, but what is it that brought you to what you're doing today? What's your background?
Yeah, great question. I love to share this with my students as well because I like to be transparent with them.
Yeah.
I think it's an interesting journey. So I'm working in exercise science, physiology, nutrition now, but that's not what my background was when I was an undergrad. I was drawn to science. I like learning how things work. When I was in high school, I enjoyed chemistry because I liked figuring out how things worked on a matter level. And when I was going to college, I wasn't really motivated to go to college. I did it because I thought it was expected of me. And
Sure, I get that.
I did well in chemistry, so I'll pick chemistry. And liked it in college, did well, and got a job out of college. So I'm a chemist. My background undergraduate is a chemist. I worked in the pharmaceutical industry for several years. But ever since I was probably 15 years old, I've been a competitive endurance athlete. And once I started doing that, I just became kind of personally fascinated with what goes on in the body down to the cellular level when someone trains for something.
Okay.
So what is going on in your muscle cells that allows you to lift more weight after you've been lifting weights for a while? Or what allows you to run faster or bike faster after you've been training? Or on the reverse token, if you stop training, what is it that's going on inside your body that's causing you to get slower or weaker? That always just personally interested me so much that when I was an undergraduate and I went to the bookstore to buy my chemistry books, I was buying physiology textbooks and reading them just for personal interest, just for fun.
That's amazing. Okay.
Yeah. So, like I said, I worked for several years as a bench chemist in the pharmaceutical industry, and I liked what I was doing, but I was passionate and fascinated with the physiology of sport performance and also how nutrition plays a role in that. And it got to the point where I was like, it would be nice if I could do something professional with this. So after a lot of self-talk, I thought about teaching because when I was an undergraduate, I had the opportunity to be an undergraduate teaching assistant for a chemistry lab, and I really liked it. And the few instances I actually got to teach my students, I was good at it.
Yeah.
So I'm like, okay, maybe teaching. And I said, I don't think I have the patience to be a high school teacher or middle school teacher. I'm like, college professor. That sounds pretty cool. I'd have the opportunity to do research. I only had a bachelor's degree at the time. So if I want to do this, I'm going to need an advanced degree. I need a doctoral degree if I wanted to be a tenure track faculty member. So I was in Connecticut and I started kind of researching graduate schools and exercise science. And that's actually when I discovered Southern Connecticut State University. I've been living in Connecticut for almost 9 years, and I hadn't even heard of Southern.
Did you do your undergrad in Connecticut?
No, it was actually in Massachusetts.
It was,
at UMass Amherst.
Oh, okay.
But moved to Connecticut for a job. So I was living in Southeast Connecticut, and was researching programs for exercise science, found Southern, and I didn't quit my job and then go full into that because you know what? I said, I don't even know if I'm smart enough for graduate school. Like, I think I am, but I had no idea. So I was working full time and just registered for one class. It was an advanced exercise physiology class. I said, let me just see if I'm cut out for this.
Yeah.
Within 2 weeks, I knew this was it.
That's amazing.
And finished the class, quit my job, came back to school full time the next semester. So in my mid 30s, I was like, what was I, 32, 33 at the time, quit my job and went back to school.
So went back to school at
Southern.
At Southern. Okay.
So got my master's degree in exercise science, concentration in human performance at Southern. Did a thesis study.
Yeah.
And then continued on. I went to UConn in the stores for my doctoral degree in nutritional sciences.
Gotcha.
Because that's what I was interested in. The human performance degree is my master's program, really got me into physiology, learning more about that. Learned how to do research with my thesis project.
Yeah.
And then was always interested in the nutritional aspect, nutritional intervention with human models, which I found an advisor at UConn whose research line was right in line with what I wanted to do.
Right.
So I did a study there looking at how chocolate milk affects recovery from endurance exercise, which got a lot of attention.
Yeah, right.
So got my doctoral degree. And when I was a student at Southern, I said, I'm doing this hopefully to get a tenure track faculty position somewhere. And I was willing to go anywhere.
Yeah.
But when I was at Southern, I said, it'd be really nice if I could find a school like Southern because they were really student focused. They legitimately cared about the success of the student, but really challenged you appropriately. I'm like, I would really like to find a program like this.
Yeah.
Long story short, when I was looking for a faculty position, Southern was looking for a faculty line at the time. And here I am 15 years later.
So just the right timing.
Yeah.
So it sounds like you were kind of putting together the pieces of this puzzle as you were going throughout your college career, your undergrad. And so now what brought you to Amherst? Were you originally from Massachusetts?
No, I actually grew up in northern New Hampshire.
Okay. All right.
And I wanted to experience more of the world. Massachusetts is only just south of New Hampshire, but a lot of my friends were going to UNH, University of New Hampshire. Right. And, I love my friends, but I didn't want it to be just like high school. I'm like, I want some new experiences. Another friend of mine the year before had gone to UMass and she said, this place is fantastic. There's so many opportunities here. Yeah. So you should give it a try. So I went to visit, fell in love with it. And that's how I ended up at UMass. And then kind of continued going south. I got the job offer from the company when I got out of UMass. And then I came to Connecticut in 1997 and I've lived here since.
That's amazing. Yeah. And so you had this light bulb moment that then put it all together for you.
Yeah. And a lot of people say, well, you changed from chemistry into exercise science and nutritional sciences. Do you regret wasting all that time in chemistry? Absolutely not. I teach courses in exercise nutrition, undergraduate, graduate courses in physiology and nutrition, and especially nutrition. The fundamentals are steeped in chemistry.
Right. Yeah.
And I have that background. I can teach it. I'm familiar with it. So I always tell my students, whether you like chemistry or not, and probably 100% of you aren't really fans of chemistry, you have to appreciate that you have to have a fundamental knowledge, and I am confident in my ability to teach you that. And it's important to have those fundamental concepts. So I use it every day. I am very glad I have that background in chemistry.
That's fantastic.
Yeah.
So you've been at SCSU for 15 years.
Yep.
In this role?
Yeah. So I've been a tenure track faculty member since August 2010.
Wow, that's awesome. Yeah. Now the Champ Center is fairly new, right?
The Champ Center, as we rebranded it, is fairly new. We've had the services that we provide. We've been doing it probably about 50 years, close to 50 years.
Oh, wow. Okay.
We used to operate as what was called the Human Performance Laboratory, which still exists. It's part of the Champ Center now, but it was last year, almost coming up in almost a year now, that we rebranded ourselves as the Champ Center. We moved into our fairly new building on campus, the Health and Human Services building. We have more space for our equipment and for our personnel. We got some more equipment. We're literally more visible. We were over in the field house where no one really knew where we were. So we're literally more visible on campus, and we're trying to make ourselves more visible to New Haven, Connecticut, New England. And I think over this past year, we've been very successful. We've had a lot more outside individuals, general public, come in for our services, which is fantastic.
Well, I know Jason had attended an event there, right, Jay, last year? So
Yeah, the opening event.
Yeah, we had our launch of the Champ Center,
Okay.
which we invited a lot of the people from the community to come in just to see what we can offer.
Yeah,
And that was a great event.
yeah,
the facility is gorgeous.
yeah. I remember you saying that.
The technology in the facility is also astounding.
Yeah.
You know how much technology progressed for athletic performance. It's phenomenal. The force plates on the ground, the motion capture systems that are there, let alone the testing of your VO2 max levels of whatever exercise you're doing. There's so much in the Champ Center.
Yeah, it sounds incredible. So it's the Connecticut Health Athletic and Mental Performance Center. So tell me more about like what the goal is here, what you guys do there.
I mean, we aim to serve everybody. So yeah, we do testing for high level athletes, whether they're triathletes, cyclists, runners, power sport athletes, but we also serve people who are not athletes and just want to be well or healthy. And the mental performance aspect, we have a mental performance consultant on staff. He works mainly with athletes, but it's more for mental performance counseling in their daily activities. So we were very deliberate when we chose our name: health, athletic, and mental performance. There's something for everybody.
That's great.
Yeah.
So who are you serving? It's not just the community of Southern, right?
No, it's Southern. It's Southern, including the general public. And general public can be New Haven County, Connecticut, New England, the Eastern Seaboard. We've had clients from as far away as Maryland come to the Champ Center for some of our services because they couldn't easily get it where they were.
And is it something that is covered by insurance, or like how does all of that work?
We're working on that.
Yeah.
Currently, it's not, but there's certain apps that people can use. We were just talking about this week. There's an app called Reimbursify, which can be used if the person pays out of pockets. We can, if there's notes that are written up by a clinician or at least someone who's conducting the test, that can then go to the insurance company. That at least maybe some of that can be reimbursed back to the client. So we're trying to work on that.
So you advise people on how they may be able to get.
We're starting to do that right now.
Yeah,
because we are really trying to reach out more to the non-athletic population. We're doing very well with getting athletes come in to do performance testing.
Sure.
We want to reach out more to the community, to people who are not athletes, but they know they should maybe do some testing to get some objective measures of different health outcomes. And we want to make that available and accessible to people.
Right. That's amazing.
Yeah.
Now, are doctors in the area referring people to you guys? How well known?
They're starting to. I mean, that's part of this past year. We're really starting to increase the retail operation. So it is fee for service. So we offer this to the general public, and they pay a fee based on what the test is. So we're trying to get the word out there, talking to clinics, physicians at hospitals, saying like, this is what we offer. I think some of your patients, your clients can take advantage of this, whether it's by referral or otherwise.
Yeah, that's amazing.
Yeah, and they're all on board. Like, this is fantastic. I had no idea you guys existed. We can definitely collaborate. We're working on collaborations with some of these physicians. So
right.
It's
so give me an idea of some of the people that are coming to you. Like when would somebody say, oh, you know what? That's a great place for this.
Well, I'm glad you asked that. We have not a small amount of clients come in who, I'm not sure if you're familiar with Dr. Peter Attia's book, Outlive.
Yep, absolutely.
We have a lot of clients come in and said, yeah, I've read Peter Attia's book. And he talks about zone 2 training, which is good for mitochondrial health and longevity. I mean, that's one of the big things of his book is what can you do to live a long, healthy life?
Right, yeah.
And one of these things is zone 2 training, which is fairly easy aerobic endurance training, which is not a new idea.
Yeah.
He just kind of highlighted it and showed kind of medically, scientifically why this is a good thing if you want to live a long, healthy life. And some people say, well, at the end of your life, you could argue those last 5 years are just terrible and no one wants to. And what he's saying is, yeah, everyone's going to die at some point, but there's no reason why those last years have to be terrible. They can still be quality. One way you can achieve that is by doing something like this on a regular basis, doing this zone 2 training, increasing the health of your mitochondria, which is something in your cells that produces an energy source.
Right.
And that is very highly correlated with not only how long you live, but the quality of your life as you live that long.
Yeah, I hear a lot about that these days. It seems like mitochondrial health is a big hot topic.
Oh, yeah. Yeah.
And it's interesting because there's just so much information out there. How much of what you guys are doing in the center, does it include guidance on supplements and pharmaceuticals that are helping people to
supplements?
be healthier?
Not a lot.
Okay.
I'm not a big proponent of hawking supplements.
Yeah.
There are certainly supplements, ergogenic aids, whatever you want to call them, that can be effective. But as far as supplements, I always tell people, since I have a background in nutritional sciences, and I have a very strong opinion about how nutrition relates to overall health, before someone dives into supplements, unless it's a medical necessity we're talking about, maybe it's there's a disease because of what they're something they're eating, they have a sensitivity to it. I say, work on your whole food diet first. Get your whole food nutrition on point first. If it's not, work on that.
Right.
If after that you still think that you need some help, however you define help, then maybe go into supplements. But I think a lot of people are relying too much on their whole food meal plan or diet is wanting.
Mm-hmm.
It could be better. And they see these supplements that are touted. I mean, anybody can produce supplements, and they can make any claims they want as long as the claim is not made to
That's
cure
the
disease.
scary part. There's so much out there.
There's so much out there, and they say, oh, that looks good. That sounds good. It worked for this person. I'm going to try that. And they think that's whatever malady or condition they're suffering from can be undone by that. Probably isn't going to be undone by that.
Right.
So I say focus on whole food nutrition first, which that in itself is easier said than done for some people.
Of course, yeah.
There's going to be barriers, access to food.
Sure.
Are you food secure? Can you afford this food? That certainly exists. But if those barriers don't exist and you're still relying on just these supplements or pills or whatever it is that you saw some athlete or celebrity who was paid to just say these words and they doesn't necessarily work on you, it probably won't work on you. Right.
Yeah. You kind of have to address that root cause first. Yeah. The nutrition and the activity level, I would assume too, right?
Yes. And I mean, this is something I tell my students, it's not rocket science. And I think the idea of the marriage of how exercise or physical activity and nutrition plays into overall health, holistic health, has been made to be unnecessarily complicated. And it really shouldn't be. There are a lot of people, mature, grown adults, who do not know how to feed themselves, and they don't know what the true benefits of physical activity are. Even though in certain aspects of life, we say like, oh yes, of course there are health benefits of exercise, and there's health benefits of nutrition. But for some reason, the emphasis always gets placed on what you put in your mouth. That's the only thing that you have to be concerned about. And nutrition is certainly part of holistic health, but for some reason, the benefits of physical activity tend to be kind of pushed aside, I think.
That's interesting.
And I think there's a lot that can be undone with better education and promotion of safe, effective, enjoyable physical activity, which I think is still has not really reached the layperson.
Sure. So that's always a part of it. It's not just necessarily about a certain diet you're going on or changing your nutritional behaviors. It's pairing that with more activity.
Yeah.
Or the right activity.
And going back to your original question, that's what we try to do at the Champ Center. If we have someone come in who's relatively healthy and fit, they're not an athlete, and they probably don't ever want to be, which is fine.
Yeah, most of us.
Right.
Yeah.
But they say, what can I do? I mean, I read Dr. Atia's book, and I read about the Zone 2 training. Can I get my Zone 2 tested here? And we say, yes, of course, come in. We have them do a cardiorespiratory fitness test or a VO2 max test. And then we debrief them. We say, okay, now that you've done this is how you use this information. This is what you should be doing. And whatever it is you're doing as far as your activity, you need to enjoy it.
Yeah.
And I think that's the big problem. People think that to be physically active or exercise, it's got to be long durations, to be very high intensity, because they see these athletes doing this, or they go to a gym and they see people.
It's got to be painful.
Yeah.
Yeah.
And they get it in their head that that's what the only thing that physical activity and exercise is, and it doesn't have to be.
Gotcha. That's really amazing. And the other stuff, the mitochondrial health, the longevity, those things really are affected by nutrition and activity.
Yes.
Yeah.
Yeah, absolutely.
Okay.
Yeah. I mean, what I always tell my students is, for the most part, focus on being physically active, enjoying it, make sure it's sustainable throughout your life.
Yeah.
To optimize that, that's where nutrition comes in. You're not going to be able, there still is no magic pill or one magic food or supplement that's going to undo what you not being active is doing for you. It's just not going to happen.
Gotcha.
Or if you're an athlete, there's no one magic pill that's going to make you an awesome athlete. It's training that's going to do that. So that's why something I talk about in my class, especially my nutrition class, my exercise and sport nutrition class, I always say, this is how I live my life. This is not what you have to do, but just kind of understand where I'm coming from.
Yeah.
I always say exercise trumps diet. There are way more benefits of physical activity and prescribed exercise than just diet, which for most people means restricting calories for weight loss. And a lot of people think that if I just lose these last few pounds, I'm going to be perfectly healthy.
Right.
Like, well, some people do need to lose weight, but a lot of people who go through intentional weight loss likely don't need to lose weight. And they'll do that. They'll kind of ignore incorporating physical activity. So that's why I say exercise trumps diet. You get a lot more health benefits from physical activity than you do just from usually unnecessary caloric restriction just for weight loss.
That's interesting because I think a lot of the diet fads, they promote getting the nutrition on point first.
Yep.
And usually it's about deprivation
Yep.
and starting to lose weight. So you see that scale, that number going down, you're motivated by that.
Yeah.
But the activity level is usually secondary to things like that.
Yeah. And I think it should be
the
reversed.
opposite. That's
and
interesting.
you talked about deprivation. There are a lot of opinions out there, which is not new, but in the age of social media, like how quickly that information gets disseminated is dangerous.
Absolutely.
Or it can be dangerous. I mean, there are a lot of viable sources out there, but usually when this information is disseminated to the masses are usually listening to people who shouldn't be giving that advice.
Right. Well, the scary thing is that for every one opinion, there's the opposite opinion.
Yeah.
And so it's hard to filter through all of those opinions to see what's actual fact.
And that's why I said earlier, just a while ago, I said there are a lot of mature adults who literally don't know how to feed themselves. They've been conditioned to ignore biological cues that have been around for hundreds of thousands of years.
Yeah, that makes
When you're
sense.
hungry, eat. When you're not hungry, don't eat. And you have some of these meal plans or diets that are recommended. It's like, oh, you should only be eating between this time and this time. Or you should be completely excluding this type of food, exclude this type of food, only eat this food. A lot of times you have two different people giving opinions that are the exact opposite.
Right.
So again, people are like, what the heck am I supposed to eat now?
Yeah. Yeah.
So no wonder they're confused.
Yeah. Yeah. I think that's the case for so many people out there. So that's great that the Champ Center is there and it's such a resource for people. I did spend a little bit of time on the website and I thought it was fantastic. I mean, it does talk about the services you provide and there's a way to contact and to talk to somebody, right? Is there some sort of like an initial evaluation or how do people start with the Champ Center?
So we have our website, we have an email address. So initially it's scheduling an appointment. They can see what services there are. They schedule an appointment. If they want just to talk to somebody first before they do anything, we're certainly willing to do that.
Okay.
I'd say the main utility of the Champ Center is to provide like a baseline number and then hopefully follow up data after that.
Gotcha.
Because there's no one test that we do. It's like, okay, you do this test once and you're going to become an awesome athlete or you're going to become so much more healthier.
Right.
We provide tests with results from the tests. We say, okay, here's the number here. Let's say someone is going through a weight loss journey. They legitimately have weight to lose, usually fat weight to lose. They're probably working with at least a personal trainer, sometimes a registered dietitian, sometimes a physician, and then they kind of include us. They said, well, my registered dietitian, my trainer said I should get something called a DEXA scan to see how much muscle mass versus fat mass. And they said, if you do that test, I can get bone information. Like we say, yes, come in. We can tell you that information. We get the results and then the debrief happens. They say, okay, let's talk about these results. Let's make sure you understand what these results mean. And once I go through the results and we talk about their fat mass and specifically something called visceral fat or visceral adipose tissue, which is something that's to keep an eye on as far as risk for heart disease. We say, I know you're on this journey. You've been working with a dietitian or a personal trainer. So as you go through this journey, which is going to take, it's not going to happen overnight. It's going to take months, if not maybe years and throughout your lifespan. Come back in another 6 months. Let's see if these numbers are on the higher end of where they should be, maybe it's like in this next quick category down. Don't think you have to do everything overnight or over in a week. That's just not safe. Even though some people say like, oh, I lost 30 pounds in 15 days.
Right.
Well, that's just not safe at all. And that's just ridiculous.
Yeah.
And it's a very dangerous thing to put out to the masses. We say, come back, say in another 6 months. And let's see if we can get down to this next category. Some of the services that we provide, I think whether you're an athlete or not, it's something that should be part of like their yearly routine every single year.
Right. Yeah.
Because let's say we have a 55-year-old female who has gone through menopause and is concerned about their bone health. They wouldn't really know unless they did a test like, for example, the DEXA scan, where it can tell you bone mineral content and bone mineral density.
Mm-hmm.
If they have that information, they can take that to their physician. Maybe they can then be referred to endocrinologists or maybe to an exercise physiologist who can start working with them for a resistance training program to increase bone health. And but they wouldn't know that unless they get the information from our tests.
Right. Yeah. It's data-driven improvement.
Evidence-based. We're big. We're all scientists. We're big on providing information of health and performance to the public based on evidence. That's how science works. That's how exercise science works.
Right. Yeah. That's fantastic. I love it. So you also mentioned kind of in the start of this conversation. So it's great to know the Champ Center's out there, that resource is there, but that you weren't necessarily on that path of becoming a professor or an educator. Something changed in you. And I know when you first mentioned it, you said that you had some enjoyment around it. Talk to me about that side of your work and the job that you're doing.
Yeah. I love teaching.
Yeah.
I mean, I wear many hats, as you can see. I'm a professor,
tell, right?
director of the Champ Center. Being a faculty member at a university, you have to serve the university, serve the departments. I serve on committees. So there's many hats you have to wear. But I mean, the main reason I went into going to grad school, changing my profession, going back to school was to teach. I mean, that is by far the most enjoyable part of my job responsibilities. So being in class with my students, outside of class, when they come to my office hours, when they email me, when they have a question about something, that's why I took this job. I mean, I found, as cliche and maybe corny as it sounds, I found my calling. I'm going to do this for the rest of my life, hopefully.
Yeah.
Because this is what I legitimately love to do. That's really get a lot of gratification when I see, that light bulb turn on, when I know I'm teaching them something that I know they've never heard of. And I see that moment of realization where not only do they understand it, but they know how they can apply it.
Yeah.
And that's fantastic.
Yeah, that's got to be gratifying.
Yeah, and I'm never going to get sick of that. I know some people who they teach and they're pretty good, but they don't stay in it that long because like they say, I teach the same class every semester. It's the same concept and same lectures. I'm like, yeah, you're talking about the same things, but it's a different class. And there are new students who haven't seen this before. And I guess they just don't get that same gratification of seeing the realization of understanding and applying it that I do. I think it's fantastic.
That's great. That's really important.
It's just, I don't know how else to explain it. It's just inherent to me. It bothers me when students aren't appropriately taught to understand a concept by a teacher that isn't that effective. I literally take it personally.
Yeah. I mean, teaching more than many other careers is something that you have to love it in order to do it effectively, I think.
Yep.
I mean, I think that's probably true of anything that you do. You want to love what you're doing. Not everyone gets that option.
No.
Yeah.
No. And I mean, there's a lot of criticism about teachers at different levels, and some of that is justified. But overall, it's a noble profession.
Yeah, I absolutely agree with you. It's so important. Yeah. Now, are you still an endurance athlete yourself?
I'll say yes. I'm never going to stop exercising. So for many years, I was a competitive. First, I started as a runner, got into the sport of triathlon, did that for several years. And after one big race I did about 12 years ago, I said, I'm going to take a break. And I took a break for a while. I still exercised, but I didn't train to compete or anything. This past year, or last year, my girlfriend and I got into doing sprint triathlons again. I'm like, you know what? I want to get back into this. So I'm now being coached one of my former students who's actually the senior scientist at the Champ Center now.
Oh, wow. That's awesome.
So I'm going to be doing more races this year. So I'll say I'm still an athlete. I am definitely older than my heyday. So I've seen my times and my speed go down, which is hard to witness, but I have to accept it.
It's part of getting older.
It is. Yeah. It is. And as a physiologist, I literally teach that in my classes. So I am living proof of that. But
right. Yeah.
Yes. So I'm still getting at it.
Now, do you have a favorite event that you've done?
I love running. I mean, that's how I started. I love running. I really, like, once I got into biking, I really enjoy cycling. Swimming, I do that just when I was getting into triathlon. I can't say I really enjoy swimming nearly as much as like going for a run or going for a ride.
Okay.
I really only do it when I'm getting ready to train for triathlons.
Yeah.
So running and biking, I love.
Okay.
Yeah.
All right. Was there a specific event that you participated in that kind of stands out in your mind? I know for me, I used to do half marathons, and I did a couple of the Ragnar relay races, and the Ragnar Cape Cod was probably the favorite thing I've ever done.
Yeah, a few that stick out. For a while, I was into trail races. This is many years ago. There's a race up in Western Massachusetts near Amherst called the Seven Sisters Trail Race.
Okay.
Fantastic. It's out and back along a mountain ridge. It's 12 miles, but you feel like you've run a marathon afterwards because it's very gnarly. That's a big one. The Big Sur Marathon out in California along the Pacific Coast Highway, that was unbelievable. There's a relay race, kind of like Ragnar. There was a relay race in Nova Scotia called the Cabot Trail Relay, which was amazing. So there's been a handful of different races that kind of stick out in my mind.
That's awesome.
Yeah.
That's fantastic. I'm glad you're getting back into training.
Yeah,
and
me
doing
too.
All those things.
It's like when I did my first race last summer for like 10 years off, like within like 3 minutes of the swim, I was just thinking to myself, I forgot how much this hurts. But
that's why we go back to it.
That's why we do it.
Right.
That's why we do
it. Yeah, we'll see.
Memory fades after the race is over. You're like, yeah, I'm going to do that again.
Exactly. So that's all awesome. So the last question that I have for you is, we usually at the end of the interview, we ask people, can you talk about maybe one thing that you have in your daily practice? And this could be physical, mental, whatever it is that helps you to stay healthy that maybe you can share with our listeners.
Yeah, absolutely. Be active and enjoy what you're doing. I mean, there's going to be days, even if people are not athletes, when you're going to be doing exercise, it just you don't feel up for it.
Yeah.
And it's going to kind of not necessarily hurt, but you just don't feel great. Those days happen. But just know that you're not going to do the same thing the next day. Try to have a variety of activity that you like, but you've got to be regularly active. Even if it's not every single day, make it at least 3 or 4 days out of the week and enjoy what you're doing. If you're just not enjoying anything you're doing, you've got to change it up. Enjoy what you're doing and be active. That's going to be so important.
Yeah. Being
active throughout the lifespan is going to be really important. And as far as nutrition, love your food. Like, so many people have just a damaged relationship with food. Love your food. Try to eat a true variety of food. I mean, medical necessities beyond. So if you have allergies or sensitivities, of course, don't eat that. I mean, there are a lot of nutrient-dense foods that you can't eat if you have allergies. So I'm not saying, oh, well, Dr. Lunn said I should be eating shellfish, but I just have to suck up my anaphylaxis. No, don't do that. Don't eat it. But aside from that, try to eat a variety of food. You'd be surprised of food that is accessible to you, that you can afford, that is accessible to you, that you probably enjoy, and you just have never tried it. So try that. Explore your food options. And that can occasionally include food that people have told you is not good for you, or junk food. I really don't like that term. I enjoy food that people would say is junk food or unhealthy food.
Yeah.
But people say, well, moderation, everything in moderation, that's part of it. So if you legitimately eat a variety of food, you're never going to be eating a lot of this food that's considered junk food, or what I call less nutrient dense, just because you're eating other foods.
Yeah.
And nobody should be like guilted or felt to be ashamed of like one single thing that they're eating. So love what you eat. Try to eat a true variety of food and legitimately love what you eat, despite what other people might be,
That's great advice. Absolutely. Well, thank you for all of that. We really appreciate you taking the time out of what I know is a busy schedule for you to be here with us today. We hope that you'll stay a part of our Sounds of Health community, and appreciate having you here today.
Of course. Always glad to help.
Thank you so much. And thank all of you out there for listening. That's a wrap on this episode of Sounds of Health. Sounds of Health is brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. A big thanks to our producer, Jason Carubia, and the awesome music by Rob Hames. Every week, we bring you the stories that inspire, empower, and help you upgrade your health. If you enjoy the show, be sure to like, share, subscribe, and leave a review. We appreciate all your support, and we'll see you again next week.